I am Dr. Kare Lyche, a family physician here with Health Partnership Clinic, and I will be talking today about the scope of heart disease and how to prevent it. Your heart carries blood and therefore oxygen to all of your body parts. It's the reason that you can breathe, the reason you can talk, the reason you can think, and the reason you can move. So your heart is very important. We should worry about heart disease because it's a huge problem. Cardiovascular disease, which includes heart disease, stroke, and several other conditions, has been the #1 killer of Americans since the 1920s and is currently the leading global cause of death. Every 39 seconds, an American has a heart attack. Every 3 minutes and 33 seconds, an American has a stroke. So all of these are big reasons. As America ages, we see it more commonly. While only 20% of 24-year-olds have some form of heart disease, 50% of 45-year-olds and more than 90% of 80-year-olds have heart disease of some sort. It is also different by different ethnicities, with the Black population having more than 50% of adults with some form of cardiovascular disease. A heart attack is something to watch out for. The classic signs of a heart attack are pain or pressure in your left side of your chest, and you probably have trouble breathing and maybe sweating. It's described as a crushing type of pain. Unfortunately, in women, this isn't always what we see, and women can also just have bad fatigue. They can have pain in their jaw, or they can have pain in their arm. If any of these symptoms happen, either call 911, go to your emergency room, or at least contact your doctor. There are several things you can do to protect your heart. One of them is to follow a healthy diet. American Heart Association recommends lots of whole grains, fruits and vegetables, low-fat dairy, lean proteins, and plenty of water, of course. Another thing you can do is physical activity. Adults are recommended to have 150 minutes a week of moderate exercise or 75 minutes a week of vigorous exercise, such as running or dancing. They also recommend 2 days a week of muscle strengthening. The third thing you can do is to avoid overweight or obesity, generally by trying to make sure that the amount of calories that come in also go out in the form of your physical activity. The other things that you can do to prevent heart disease are to keep track of your numbers. You want to know what your blood pressure is. You want to know what your cholesterol is. You want to know what your sugar is. And all of those reasons are reasons to follow up regularly with your medical provider. Those should be checked on average every year to every couple of years. So if you would like to know your numbers, and very importantly, if you'd like to quit smoking, which is also a large risk factor for heart disease, you can call for an in-person or a telemedicine appointment here at Health Partnership Clinic. Our phone number is 913-648-2266, or we can be reached on the web at hpcks.org.